for making time to join us for this report on our community's philanthropic response to COVID-19. My name is Whitney Feld, and I have the distinct privilege of going through some housekeeping rules for you. So first and foremost, we would ask that you turn off your microphone if you are not speaking. We hope that you'll have questions throughout the presentation, and if so, please send them directly to me through the chat function. We'll address your question at the very end. We have a question and answer time set aside. If we do not get to your question, please know that we'll follow up with you after the session. This meeting is being recorded, so we will post it to the Foundation website. And if for any reason you have issues with your computer connection, you can join the meeting by telephone by dialing the number in this slide, which is 1-646-749-3122. You can see the access code there as well. For your convenience, this information has also been copied into the chat window. So when we advance the slides, you'll still be able to access this information. In the next slide, please. Next slide. Back one, Dana, sorry. So we are so fortunate to be joined by Foundation for the Carolinas President and CEO Michael Marisicano, Executive Vice President Brian Collier, and Executive Vice President Holly Welch-Stubbing, who are going to lead this talk on the joint FFTC and United Way of Central Carolina's COVID-19 Response Fund and the larger community effort. Again, we really appreciate you making time to join us, and we're so thrilled to be able to have this conversation with you. And without further ado, I'm going to turn it over to Michael.
Thank you, Whitney. And I add to Whitney my welcome for the fellowship of this hour. We're thrilled you could join us. I hope that you and your families are safe and healthy. I will tell you that while no member of the Foundation team has been afflicted with the COVID virus, 4 members of our Foundation professional team have had extended family members affected by it. So it becomes closer and closer to. And that's how we are learning not only the major statistics we see all the time on TV, but also it becomes a reality to all of us. And we'll be talking today about our response to the COVID-19 program. I want to tell you who's on the phone or on the GoToMeeting. It's individual and family fund holders, and we are grateful to have the opportunity to serve you. We also have professional advisor partners on the phone, and we're very grateful to be in partnership with you. You will note that both Brian and I are wearing ties and jackets. This is the first time we've done so. In the 2 months we've been working from home. My mother always taught me you show respect for the people you serve by the way you dress. And so you see ties and jackets. What's below our belt, we won't talk about. Because I can assure you that there could be anything from sweats to shorts at this point. But at least you're seeing us being professional, and we hope that that is received well. The agenda we have before you is a multiple-part agenda, and it appears that the slide that takes us right into it is there now. Now that we have finished the welcome and overview, we're going to talk a little bit about the impact of the COVID-19. And then we're going to talk about the Community Foundation's response to that, and then to engage in some discussion on considerations for philanthropic giving. So let's go right into it with the impact of COVID-19. First, I'm pleased to tell you that across the country, the community foundations are rising to the occasion. You may or may not know that there are actually 1,800 community foundations worldwide. All of them serve donors and constituents as well as their communities as a neutral convener, helping communities face the challenges that are before them. And 800 are domiciled in the United States. And I'll tell you, they're the largest, the fastest growing form of philanthropy. And some people have suggested that democracy is reinventing itself through community foundations, which is quite a high calling. I don't know if that's true or not, but it is interesting how fast they're growing because they provide this neutral convening role that we'll talk about today, specifically in the face of COVID. We are often, as community foundations, first movers, and you'll see that we have moved very quickly on the COVID response. And we have some background that helps us present an initiative for the COVID response from the 2008 recession. You folks know that we are a banking center, and over the years, recessions have come and gone and not really had a huge impact on Charlotte. We would call them those times that we were recession resistant. But in 2008, we were at the epicenter of the recession, and the Community Foundation responded immediately to put a critical need response fund in place. Grants were allocated on a rotation basis. Profits who were seeing increased folks in lines at the Crisis Assistance Ministry or at the food banks, and we learned how to do this kind of immediate response fund. And we have gained from that experience to how we designed the COVID response fund. You'll hear Brian talk about it later. 350 community foundations have now created COVID response relief funds. Back in 2008, we were one of the only ones to do actually a critical need response fund to the recession. But now, as community foundations have grown and gained in experience, we find that 350 of the 800 United States are now doing COVID response funds, and they've already mobilized $723 million in contributions to help their communities, and they've already allocated $300 million in grants. On the next slide, you'll see that they are doing this mostly from home, as we are. We have all transformed our home environments. I'm very grateful to our board because for the past 5 years, they have pushed us to have a business continuity plan in case something like this happened. They didn't predict it'd be a pandemic, but they did think something could happen, and it's good business practice, and we've honed that over the years, and it turns out we have been able to move home with not missing any beat, and we hope we've not missed any beat for you folks. 96% of our peers are also working from home. And while we've been at home, in addition to helping the COVID response effort on a national level and a local level, we've tried to enhance communication to you on the performance of FFTC's investment portfolio. We've tried to offer these virtual program offerings for our different centers of giving, whether they be the nonprofit center, the family center, or the corporate center. And we've tried to have seamless transition of client board meetings on web platforms. In terms of this trusted partnership in working with you and your funds that you hold, we have been doing that through the donor advised funds in particular, and you folks, through your family funds, have granted $10 million in just 8 weeks to organizations that are working on COVID-19. Now, this is not the fund that we're going to talk about that the foundation has initiated, although some of these dollars did wind up in that fund. But many of these dollars have gone to organizations that you have deemed worthy to help our community in this challenging time. And we've adjusted all our board and committee plans for 2020 to meet the increased need of the community at this time. The next slide, please. Specifically, in addition to helping our fund holders, we have responded by a major Mecklenburg County fund in partnership with the United Way of Central Carolinas. And while the grants are not limited to United Way agencies, they are disproportionately going to human services, which is appropriate given the pandemic. So thought it was important to partner with them. But we've also launched in other counties as well, as those citizens have coalesced to launch. So Cabarrus County has a fund that we're orchestrating with them, Iredell, Union, and York counties. We've also worked really hard to help our nonprofit fund holders who have endowments with us to educate them on the CARES Act, because nonprofits under 500 employees are able to enter the CARES Act, get the PPP loans and grants. And we have been successful in having many of our nonprofits get those resources. So we're thrilled about that. And then we've been serving on a lot of thought leadership and advocacy processes to work with our partners in philanthropic responses. In particular, Brian and I are serving on several reopening committees that the community has created. And then something you may not know about, but we'll talk about in more depth, is the one national program that we do run is called E for E Relief. It actually started in serving local corporations during 9/11 who wanted to give direct grants to individuals that were under their umbrella as employees. That program has grown to a national program and has been called into service in a very significant way for the COVID response. And Holly Welch-Stubbing, who directs that, will talk to you more about that in a few minutes.
Before we move on to the next slide, all callers that have called in, please mute your phones. Thank you.
So now that we've talked about the those items, we're now going to go into the next agenda item, and you can move to the next slide, Dana. And that's to talk a little bit about how COVID impact has affected our community. As of May 8th, we know that 1,983 cases have been identified, and we've had 60 folks in Mecklenburg County pass away. Unemployment has grown exponentially and is now much higher than it was in the Great Recession, so the needs are even greater. And we jumped by about 12% in unemployment just from February to March. There's a great deal of uncertainty about the length and depth of the impact of the COVID virus. The nonprofits we serve have never been more compromised. In the Great Recession, they were getting larger lines, and they were reducing some impact of their, they had fewer resources, but they didn't have to also convert all their work to being at home. Nonprofits are now having to not only deal with increased need, dwindling resources, but also the infrastructure to do all this from home, which is particularly complicated for agencies like food banks, which have to be on the line. The federated funds have already been in decline, which has exacerbated the situation that our nonprofits are in. And they have limited revenue generation possibilities, and that's particularly the case in the arts community. We also know that there's a disproportionate impact on COVID-19 of communities of color. And this is showing very clearly how much our work of economic opportunity and upward mobility has been important over the years, because we're seeing very visibly the gaps related to that in disadvantaged communities. And I think it's actually raising the public perception of the disparities that exist. I would like to say, before we switch to the next slide, another point of interest. The majority of the COVID cases in Mecklenburg County are actually between the ages of 29 and 50. We have this perception that it is older folks. It's actually younger generations that are getting the COVID virus more frequently. However, the good news about that age group is they are not dying. The folks that are dying are the folks that are 65 and over. So we're talking about whether or not there needs to be a public relations campaign to educate the younger generations that they may get this and they may recover from it, but without doing social distancing and wearing masks as we reopen, they could be giving it to people who will die from it. So we're thinking about how we might help so that the most vulnerable of us are not inadvertently affected by the COVID virus because others of us who are not as affected don't have the safe practices that we need to have in reopening. Next slide, please. So we are in an unprecedented situation. This is both a sprint and a marathon, and I've usually done one or the other, but both at the same time is a whole new experience. The impact is likely to continue in the weeks and months, and perhaps even as much as 18 months until a vaccine is secured. The nonprofit organizations that are serving our most vulnerable residents are having this increased demand with decreased financial resources. And they are also a major employer themselves. And they are facing these huge operational shortages. I mentioned earlier just the food banks. Well, the food banks depend on volunteers to deliver the food. Well, the volunteers now are sheltering in place. So how do you get food delivered when the volunteers are no longer there to do it? These are the challenges that our nonprofit communities are facing. The next slide goes to our third agenda item, which are the two major efforts that we've launched, one regionally and one nationally. So the bulk of our time will be given to Brian Collier on the Mecklenburg County COVID-19, and then Brian will toss it to Holly Welch-Stubbing on the national effort that we're leading.
Thank you.
Brian, take it away.
Thank you, Michael, and it's great to see so many familiar faces, and I hope all of you are doing well. I would just ask, I think there's one person who hasn't muted on the call, and if you could press mute, we can hear you talking and other sounds. So thank you for doing that. So I'm gonna talk on two of our initiatives, one of which is the Mecklenburg County COVID Response Fund, which will spend the bulk of our time because most of the issues related to that are also related to the issues that our regional folks are facing. And then we'll touch briefly on what we're doing in other counties like Iredell, Stanley, Cabarrus, places like that. Next slide, please. So with the COVID Response Fund, and I know I see Anna Nelson on the call, who's a part of this, and others, but the COVID Response Fund, first and foremost, started as a partnership with various organizations across the community, the county, the city, our major corporate partners, private foundations, individual donors, and houses of faith. When you look at this list, you probably think, well, where's CMS in this? Well, CMS has created a separate foundation that we have been in communication with. They are primarily focused on what happens within the school buildings and for children, but we are working closely together with them, but they're not a direct partner with us in this particular fund. This fund, the Charlotte Mecklenburg COVID Response Fund, is a partnership with the United Way. During the recession back in 2008, we were not as closely aligned with United Way for a variety of reasons, but I'm really happy to see how that relationship, it's been strong for the last several years, but this has actually helped us a great deal in strengthening the partnership with the United Way, and we need them to be strong in the community. Those of you who have been at some of our civic leadership meetings over the last several years know that although we have been leading on a lot of issues, it is not a good thing when the foundation is leading on everything. Our shoulders aren't that broad. We can't take on everything. So having a strong United Way, a strong ASC, strong other institutions is a really good thing. So we're working with United Way. We're also working with local leaders. The city and the county have helped us a great deal, as has organizations like Charlotte Works on the economic development front. And it complements. It's not meant to duplicate things. We're actually mapping community resources to understand where stimulus dollars are coming in, where other donors, I'm in constant contact as much as possible with other major donors to find out what they're doing. There are things where we're connecting donors to things that perhaps we can't fund through the fund, or we can't fund at the scale in which the need is out there. So I'm going to touch on this a little bit later as well, but right now, and from the very beginning to the current point, the biggest need in the community for this fund to meet are basic human needs. And the philosophy, I think this might be a little bit of a nuance, but the philosophy for this fund is we're not funding organizations necessarily. We're funding the needs of individuals in our community that are addressed through nonprofit organizations. So this is not a fund to prop up nonprofit organizations. It's not going to be the rescue fund to ensure that nonprofits exist. It's really about identifying those organizations in the community that are best situated to address the tremendous human needs that have been created through this crisis. By the way, I would also say, those of you who know me know that my background, although it's not apparent as much anymore, is I started as a trial attorney. And as a trial attorney, you always think about causality. And so one of the things that we're thinking about when we think about this fund is what can be causally sort of related to the crisis. So again, it's not about all of the things that existed prior to the crisis. It's about what changed in our community as a result of this crisis. And so one of the things that we're trying to tell everyone is not only are this fund is sort of that inflection point with the crisis, but we need people, we need donors to continue supporting the organizations that they supported prior to the crisis. This should be on top of that to really help with that increased need and capacity development. The other thing I would just say that the fund is also trying to retain a sense of flexibility. Where we were in mid-March when the fund started to where we now are in mid-May is very different. We're continuously looking at what are the needs in the community, how do we evolve, and then also how do we look forward? And again, I'll talk about this a little bit more in a bit, but how do we look forward 30 days or so to anticipate what the next level of needs are going to be, especially as we look to sort of, let's just say June 8th date, when CMS will no longer have sort of the structure responsibility for the life of a child. What happens after June 8th and how is our community thinking about that? Next slide. So as I mentioned, Anna, a few minutes ago, the fund is structured with two governing bodies. The first is a board of investors, and these are the larger donors to the fund. And they provide sort of an oversight to the fund. They give us, I always say they give us their wisdom about the direction of the fund. They help inform, especially at the very beginning, they informed where we're going with the fund, what are going to be the parameters, what are the priorities, things like that. And it's a fantastic group of individuals who represent the city, the county, major donors in the community. And I'm especially excited about some of the organizations that we haven't really seen at the table in the past quite as much, like a Lending Tree, who came in early on, Truist stepping in, Lowe's, Ally Bank, Coca-Cola, companies like that have been fantastic in philanthropy in the community, but not at the collaborative table that this has allowed us to do. Next slide. So there's an investor board that provides their wisdom and guidance, and then there's a grant-making board that is getting the work done day to day in terms of specifically reviewing all of the grants that come in and making a grant-making decision. That committee is co-chaired by Tanya Blackman at Novant and Edwin Peacock. And what we've tried to do with this group of participants is how do we get as much diversity of thought in the room as possible, while also kind of keeping the grant committee compact so that we don't have, so that we can get decisions made in a timely manner. So you'll see some overlap with people like Charles Bowman and Dina and Betsy Conway at Lowe's, people like that. But we've also added a number of diverse members of the houses of faith, members who represent diverse backgrounds, like helping to lift up some of the more neighborhood and grassroots efforts. Also various different groups like our immigrant population, things like that. So, and also one of the things that we don't think about as intentionally sometimes at the foundation as we should is we also have diversity within Mecklenburg County. So we've got individuals who are representing our northern Mecklenburg areas and southern Mecklenburg as well. So sometimes I think we tend to sort of do what is easiest, which is get people from Charlotte in the room. And we often overlook Davidson, Huntersville, and Cornelius, Matthews, Pineville, places like that. So we've been very intentional about having representatives from that at the table as well. Next slide. To date, and I will tell you that our public number, this is our public number, we've raised $17,527,000. We actually do have other grants that we know of that will be coming in hopefully soon. That my hope is to get us above that 18.5, closer to 19 million, and maybe even a little higher. We also have at least one major donor who is not in the fund directly, but is augmenting grants that the committee, so they've decided to look at the list that the grant committee has put together, and that they will come in to meet some of the needs. So although they haven't put their money in directly, they are taking the grant committee's recommendations and augmenting that. So we've got a number of donors who are doing some interesting things. And again, I would just stress that it's our hope that this $17.5, $18 million is on top of what all of our donors are doing in the community with individual groups. Next slide. So these, in addition to just basic human needs, I thought I would just tell you a few things that are popping up more recently that you should be thinking through as donors. Certainly the highest need tends to be our basic human needs, but there are nuances within that, and then there are long-term concerns that organizations are starting to report. So for instance, although organizations have moved to things like telehealth, or telemedicine, or telepsychiatry, or things like that, there are limits to that. Obviously, if you diagnose something, then you need to be in person. We're also finding within telepsychiatry, there are limits to things like addiction services. Those services are best done person to person. And so we're trying to figure out, okay, what does it look like if they can't be done person to person? I say that also with some interesting little caveats. So for instance, one of our organizations that's working with LGBTQ youth has actually reported that they've had better counseling sessions via Zooms and things like that. And the thinking is that the kids are more open to talking about things that are more, in other words, this little bit of separation is encouraging kids to have more authentic conversations with the therapist. So it's interesting how there are pluses and minuses to this. A big issue that we're facing in the community is with the social distancing criteria, we are seeing pretty drastic reduction in our shelter capacity. So where you were able to house, say, 400 men at the men's shelter, when you think about how they were housed, bunk beds very close together, they're having to drastically limit the number of men or women and children at the Salvation Army. And that's causing big issues about where those individuals stay. And then you've got these knock-on effects about, well, okay, well, let's put them in transitional housing or permanent housing. Where is that? Because we already had a shortage before the crisis. We know that we're providing an immense amount of financial assistance out into the community, either through stimulus dollars coming in or through direct emergency loans that we're making through an organization like Commonwealth. But we also know that families needed before. A lot of the stuff that I say is we had this need before, it's just been amplified. But we know that financial counseling is needed so that that money is used to its highest and best use. The other thing I would say is that we're seeing growing concerns about adult and child mental health issues. And I say that for both staff and clients. So just as an example, we are talking in pretty regular fashion to about 35 organizations just to kind of pulse check with them every couple of weeks to find out what the big issues are. And for the first time, I did a call 2 weeks ago with about 8 organizations, and every person I talked to, including some of my most hardcore leaders cried during that call because of just the pressure that they're under and their concern about their staff. And so I think that we're going to have to really start to address this issue of how this crisis has increased the level of anxiety and stress for all of our people in the community, especially those. Think about the nonprofits, as Michael mentioned earlier. We have the capacity to work from home. Many organizations like a food pantry or a food bank do not, and their staff are questioning, why do they, not that they don't love their jobs, but they're questioning about, why are they risking their lives to do their work while others don't have to? And these are just things that we're going to have to address in the future. The other emerging escalating needs that we're seeing are certainly from a child welfare perspective. A lot of these kids were facing very challenging situations. They have been amplified now that they've been limited to the home, to a very close environment. We know that those issues have escalated. We know that there is a need for legal advocacy, and although courts are closed, that has not diminished in any way, shape, or form. One of the things that, in fact, I was on another call earlier today talking about is we have not yet seen a comprehensive plan to address the education, academic needs, or the recreational needs of children over the summer. In fact, we know that places like the Y will not be able to go back to providing services at the scale in which they have in the past. We know that places like Freedom Schools will not be operating physical locations other than mobile pop-ups. We know, I could go on, but we know that when you think about where children will get fed this summer and where they will get academic and recreational activities, we don't have an answer for that. And we're trying to figure out whether we can maybe even use some of the funds from the COVID response fund to help catalyze some discussions around that. And just as an example, so CMS will sort of close on June 8th with formal structured programming. And then one of their big goals will be, how do they flip the buildings and clean them, get them clean and ready for an August 17th, hopefully an August 17th start date. So much of their attention will shift from teaching kids in that environment and ensuring that they have structured time to then getting the buildings ready. Well, that doesn't, that's great. But if we can't use those physical structures, then what do we do? So I think we're trying to figure out, all of these things are very, very challenging, and we've got to figure out a way to address that. Certainly, unemployment rates are going to present a challenge. And then the one that consistently we heard from every organization that we talked to was two issues. One was mental health issues, and then the other was an increase. So we've seen a dramatic decline in crime of all types, with exceptions of domestic violence and sexual abuse allegations. So these are two areas that we've really got to figure out. Again, the longer that we're all sort of sheltering in place, and even with relaxation of that, these issues did not go away and are in fact are increasing. And then, as I mentioned, and Michael mentioned as well, we're continuing to see these organizational challenges of staff wellness, loss of revenue, and then everybody's concerned both from a practical standpoint and from a legal standpoint about how you open. How much liability are you willing to take on to do, are you willing to do a summer camp? Are you willing to do, even at the foundation ourselves, what are we willing to do with our staff coming back? And what are the legal implications to bringing them back into this environment? Let me stop to see if there are any questions. I know we'll get some in a bit, but are there any questions with what I've talked about so far? All right, let me move to the next. So what we were trying to do, as all of you know, who, especially those of you who have attended our grant making seminars in the past, we think about grants in a couple of different ways, 3 ways to be specific. One is directed grants, meaning I know the entity, I know what I want to solve for. I know basically the entity that I want to use to solve that problem. And then it's a matter of negotiating the terms and the amounts. The next is competitive grants, which means We sort of have a focus area, we allow everyone to apply, and we make decisions based off of that. And then the third is really sort of our civic leadership leverage grants, which means I know the problem that I'm trying to solve for. I don't know the solution to it. I might not even know the organization, but we're trying to figure out how to solve for that. So those are 3 buckets of grant making. So what we did in this grant program was the first round was really directed grants, meaning I knew where to go, I knew who I needed to fund, I just needed to negotiate the terms. And we chose 14 organizations that were in the areas of financial security, housing security, educational and things like that, and food. By far, the largest grants cumulatively have been to food. And that's an issue I'm going to talk about in just a few minutes. But these were the organizations in the first round that we made directed grants to them and are holding them accountable for the outcomes from those grants. So you can see it's food, it's things like our shelters, income security through Commonwealth, where we're making 0 interest loans to individuals. We're trying to help the immigrant population. We're also trying to pilot some programs where, although there's no evictions going on right now and no utility cutoffs, one of the things that we're trying to pilot through social service, how about going out and negotiating with landlords and trying to figure out who's most vulnerable and how can we get ahead of the lines that will appear in front of crisis in a month or so. Next slide. So then the next round that we did in April 9th, was the open cycle, where we tried to look at, we received 173 applications from organizations, a variety of different diverse areas in terms of geographic diversity, need, by population, by organization. One thing that we've been very conscious about in this program is how do we serve small and medium and large organizations. And we do that. I wouldn't necessarily do that as much in the direct foundation grants, but I've learned a lot during this whole process about who gets the job done on a day-to-day basis and who can be most nimble and flexible in a crisis. And oftentimes that isn't the larger organizations. If you think about the challenges that an organization like the Y has faced, or like Crisis Assistance Ministry, they have done the right thing for their institutions, but they haven't been the most nimble and flexible in the moment. And so we've really been conscious about how do we lift up organizations that have capacity to deploy, and that has meant taking a bit more of a risk in certain cases. So the criteria for the applications that we looked at were things, again, basic human needs, capacity, and that their ability to really reach into marginalized communities. And then we also certainly gave consideration to the amount of funds that we have available, over what time period do we want to be able to give these funds out, and then looking at overall quality of the applications. And so one of the things that the investor board has told us is that we need to spend about 20% or so per grant round, because this has to last several months. So we ended up awarding grants to 51 of the 173 applications. And again, right now, those grants are all in motion throughout our community. Next slide. Just one thing I want to just touch on, one of the things that we're trying to do with all of our grant making boards is looking at how can we teach them about a certain aspect that they may not be as familiar with or not understand how it works. One thing that we took them through in the last board meeting was the food ecosystem, and really drawing distinctions between a food bank, which there is only one of, which is Second Harvest, and that is really the central place to warehouse food in the community and distribute it out to organizations that have been vetted. And by vetting, I mean that they have agreed to certain health and nutritional codes. They have agreed to income verification, things like that. And their primary goal of Second Harvest is not to deliver food to the end user, but really to bring it all in, package it, and then send it out to their partners throughout Mecklenburg County, actually throughout the region, but primarily for our purposes here in Mecklenburg. And then the next biggest player in the food ecosystem are the pantries. By far the largest is Loaves and Fishes. And Loaves and Fishes, actually, you might see pantries being run in various settings throughout the community, in a church or an institution, but actually Loaves and Fishes may be the one that's behind that pantry. So we've been coordinating with them, ensuring that that we don't duplicate. Oftentimes in crises like this, you get the creation of a lot of pantries. Everybody wants to create a rent and utility program, financial assistance program and a food program, and we're trying to limit that. And then on the far end of the continuum, you have various different players from meal programs like backpack programs, kids cafes, soup kitchens, and partners where the food is provided through Second Harvest, but to clients like at Urban Ministry, places like that. Just one of the things I would touch on food is that is something that we are continuously monitoring, because we have seen both a dramatic impact to the system from their inability to get donated goods from Harris Teeter and Publix and Food Lion. So they're having to go on the market and pay higher rates for the food. We're also seeing limitations in things like meat products. We've got all the produce that we need. We've got all the dairy that we need. That is coming in through both USDA programs and through excess produce with their big grocery store partners. That's not the problem. The problem is canned goods and meat products is the thing that they're trying to solve for right now, not just in Mecklenburg, but all across the country. And typically you would have drawn from food banks who have shortages. That obviously can't be done when you've got a crisis of national scope. Next slide. So at the April meeting, we made just over $3 million in grants. You can see the bucketed. So we made 51 grants to 51 organizations. The majority of those are for 3-month grant terms. We're trying to get the money out as quickly as possible. This is not a year-long program. And then you can see where we made the contributions. And the bulk of them are in the buckets of shelter and housing and food security. My guess is that we'll hopefully with tomorrow, we have a meeting tomorrow, hopefully we'll close out food for a while with a big grant, hopefully, and we'll start to come back on areas of education, employment, things like that. Next slide. We also had the opportunity to carve out a block of money to help with some of the arts organizations, and we made 5 grants at the last meeting. The Arts ASC Resiliency Fund is giving grants to individual out in the community, individual creatives. And then what we focused on were those organizations where we could look into their budgets and preserve salaries for artists, educators, and other creatives. So, or we could move programming online for children and families like a children's theater. So that's a small bucket of grants. To date, next slide. To date, we've given out $6.5 million. Next slide. So I just want to touch quickly on leading up to the next round. We've continued, the investor board met a few weeks ago and gave us additional guidance and said, keep focusing on basic needs, but start looking at issues of education and mental health. We need to look to the areas of food, rent, and utility assistance as the areas most ripe for ensuring efficiency and effectiveness. Continue to map all of the money and resources that are coming into the community between the PPP, CARES Act, other stimulus dollars, things like that. Continue focusing on large, mid, and small organizations, but ensure that the grants are given in proportion to that organization's capacity to manage those funds. And then I think we naively thought that this fund might be done by the end of May when we first set it up. The investor board has said, you're going to need to make it last longer. So we need to stretch out the grant making cycles to maybe every month or so and combine it maybe with some other hybrid grant making. Next slide. So just a quick preview of the round that will take place tomorrow. They'll be making decisions. So we have about almost $11 million in grants, grant capacity. We received 254 applications, which was a lot of grants to read. About just over $16.7 million in total requested. We are recommending to the board that they prioritize 71 of those. We got 25 arts applications they'll be reviewed separately. If they're all funded, it'll be about $3.8 million that we're recommending go out in this round. We're also, I just want to quickly touch on a couple of considerations that we're looking at from this round. We have heard out in the community that a lot of nonprofits were unaware that they were required to have a solicitation license for the majority of them. You as donors and fund holders know probably that that is a requirement, and it's actually the Secretary of State asks for that. We have heard a lot of organizations saying, we didn't know about this, and are you going to exclude us? We are trying to help organizations, especially the smaller ones, but actually there were some mid and large who didn't have a license. but we're trying to help educate them through this process. I would also note just a couple other things. One of the things that we're looking at in this round is there are a lot of organizations that are working very specifically with people from a specific country like Liberia or Vietnam, places like that. And they do not show up in the lines of certain organizations. And so we're really being very intentional about reaching out to organizations that have that very close tie to certain populations. Other thing is, if I granted all of the technology requests, laptops and tablets, I would probably be one of the largest technology buyers in the country. Apple, Google, and Microsoft would all be extremely happy. We're trying to figure out what are the best needs and highest needs, and not just because every organization thinks they need iPads and Macs and things like that. So we're being very thoughtful about that. And as I said, there's still no comprehensive plan for the summer. Next slide. So let me touch really quickly, next slide, on our regional approach to this. So as you know, we serve a 13-county region. We have launched specific mirrored programs from this program in Mecklenburg and Cabarrus and York. It was made possible by a number of our local fund holders, and we're very thankful for that. Again, we're partnering as best we can in the United Way in Iredell and other counties. And then some of our boards have just simply taken their grant-making capacity, some of which has been augmented by other donors, and sort of refocusing their effort to meet the COVID crisis needs in their communities. Next slide. So as an example, here's Cabarrus County. It was launched by our Cabarrus County Community Foundation. We got an anonymous lead gift of $150,000, and they've raised over $500,000. And then that has been augmented by support from United Way and by Lowe's. Lowe's actually gave us money to work in Iredell, Cabarrus, and Union County. And so far, they've had 3 rounds where they've awarded over $400,000. Next. In Iredell, we're working, again, partnership with the United Way of Iredell County. We got a lead gift there again from Lowe's, which is where their headquarters is actually located. And we've raised $360,000, and grants have been done in close partnership with our community foundation in that area. In York, we've raised over $175,000, again, launched and seeded by local donors. Our York Community Foundation is making the grants in that area, and they have approved $130,000 to 15 local agencies. And again, we're working closely with other foundations in both Lancaster and York. In Union, again, partnering with United Way, and they are the primary leader of this one. We have received major gifts from Lowe's, First Citizens, and Union Power, and it's done in partnership with our community foundation. So I hope what you're seeing is, as much as possible, we're trying to partner with key organizations and the United Way, who has a regional presence. I'll turn it over to Holly.
Good morning, everyone. This is Holly Welch-Stubbing, and I wanted to talk to you a little bit about our national response for COVID-19. Michael talked a little bit about the Foundation's national subsidiary, E4E Relief. We've been around doing this work since 2001 for 9/11. The Foundation for the Carolinas hosted these types of funds, and we'll talk a little bit about what kinds of funds I'm talking about. But essentially what happened is that we, spent many, many years, Brian just spent a while talking to you about the infrastructure and knowledge we've built around grant making to organizations across the region. And since 2001, the Foundation for the Carolinas has been building infrastructure around grant making to individuals. And so that grant making has really kicked into gear the last 4 years. That's when we created E4E Relief. That's when we launched it and went outside the bounds of this region. And E4E is essentially a service that creates infrastructure to make grants to groups of individuals or to employees of companies, which essentially create the charitable class of eligible recipients from the funds that are created. Most of the folks that we're working with are mid-market and Fortune 500 companies, and we are doing this in the form of an employee relief fund. An employee relief fund is essentially created when you establish a fund, put assets or gifts into that fund, and then design a program around grant making for a particular group, in this case, an employee base. And so we are doing this for roughly 75 companies across the US and 4 million employees worldwide. About 400,000 of that 4 million are outside the United States. We have been in the throes of a major COVID relief effort ourselves since early March. Because of the nature of these employee relief funds, essentially they do sort of two functions. They respond to catastrophic disasters, so individuals who experience a catastrophic disaster or loss, typically through a weather-related event, that be natural disaster, hurricane, tornado, or it could be something more personal like a house fire, or something personal to them that creates financial hardship. Anything like that that creates financial hardship is eligible under the Internal Revenue Code for a grant for relief. And so what's happened in this global pandemic is that we know from everything Brian has just been talking about and Michael mentioned, the significant and deep economic changes in our environment have really created substantial financial hardships and other food and housing insecurities for individuals across the country. This opportunity around helping these folks is proven to be, the infrastructure that we've created has proven to be particularly helpful right now. E-Free Relief is about 35 people of the foundation's total employee base, but in addition to that 35, we've hired over 60 people as of this morning. So we are scaling up in this disaster to serve those who need us. So let's talk a little bit about what that looks like. We know that the emergency declaration by the president on March 13th essentially created a qualified disaster. And so since late February, early March, really around March 14th, honestly, we have seen 52,554 applications as of this morning. And we've awarded 37 million in grant awards. And our previous highest number prior to this year was 13,000 grant awards in that hurricane season that was so devastating with Harvey, Irma, Maria, Nate, and the wildfires in California. And so our total grants since late March, just for E-Free Relief that we've processed have far surpassed all previous FFTC-wide annual grant totals in terms of numbers. We know that the hospitality, retail, sports industries have been particularly hard hit by this crisis, and we're seeing many, many applications from employees who are hurting from the standpoint of their basic human needs, and it really tracks very well with what Brian was talking about, our local COVID response fund and what nonprofits are seeing. We are seeing applications for food, for childcare, for housing related needs, and some medical needs. We also, as Brian suggested, are also seeing some mental health issues coming through the applications. So we also, at the same time, while this kind of ramp up has been going on, have had quite a few corporations and other groups reach out to us to establish disaster programs or employee relief programs. We've had over 300 inquiries since mid-March, and we've seen over $110 million contributed just to E-Free relief programs in the last 6 weeks. Of that 300, we've onboarded 25 new companies with employee relief programs. Several of these companies are coming in with very specific COVID-related responses. So, for example, Hyatt has come on board with us, and as you might imagine, has some very deep and specific COVID responses around the world. We did go live with a national program for the PGA. 1 million employees involved in golf in this country, many of whom are people taking care of the grounds, people in the hospitality field, and the industry is significantly impacted by the current situation. And so we've had a tremendous number of applications from folks working in that industry. The CEO of the PGA has been talking about it a lot. He did a piece on Squawk Box related to the relief program that they've set up for golf employees, and that has been an interesting thing to be a part of, because you're really seeing some of the significant wellness issues happening in that space. In terms of other companies we've been working with, it ranges from Gap to Estee Lauder to Lululemon to the Cincinnati Reds. But I think the fund that we wanted to make sure that you knew about today, in addition to our sort of larger E4E relief COVID efforts, is the Brave of Heart Fund. Something that we believe will be a response that is very, very important and sobering in this environment. Dana, if you can move I guess the slide's not moving on us, is it? There it is. So I'm really pleased, and hope many of you have seen that New York Life and Cigna. New York Life is a current client of E4E Relief. They have an employee relief program nationally that we've been running for them for over a year. They approached us with Cigna out of New York City, both of them, to establish what has been called the Brave of Heart Fund. And this fund was established with $50 million in seed funding by both companies, $25 million each. New York Life is providing another $25 million in matching funds for individual and corporate contributions. And the output of this fund is to provide financial support to the families of healthcare workers who will lose their lives to COVID-19. They will also be providing, through Cigna, physical and emotional wellness resources to aid in the family's recovery. Since we launched the fund about 2 weeks ago, we've had 1,100 gifts to the fund from all over the country. And the idea of the fund was to provide monetary grants to help with things like funeral and burial costs, medical care, education for children who are currently in school who would be jeopardized by the loss of that income stream, any housing insecurities or living expenses that would be very difficult to continue without that income stream. The fund will be, the grants will be provided in 2 phases. Phase 1 will be awarded for funeral and burial expenses and other immediate needs. And phase 2, which will launch in about 3 months, will have an additional up to $60,000 in grant opportunities. So there's a total $75,000 available to survivor families who meet the income requirements associated with this fund. And it will walk through the same, that's why I kind of started with the grant making to individuals. This infrastructure that we built around that can be applied in this circumstance in addition to an employee relief program. I believe I saw somebody ask how long it takes to open a relief program, and it depends on several factors, but it can be a fairly short period of time if the complexity of the contracting and the setup is fairly simple. If it's a large corporation, there may be procurement involved, there may be contracting things that slow things down, but for many mid to small size businesses or other things, it is a fairly short turnaround. I would say less than 3 to 5 days. But back to the Brave of Heart Fund, we will be launching phase 1 grants here in the next 3 days or so. And one of the things that I thought was particularly interesting, you see this quote up here. We've had, as I mentioned, 1,100 gifts. This is one of those gifts. And it is a mother whose daughter is a nurse, and she prays every day for the safety of her daughter going to work. And to calm her anxiety, she makes fabric masks for the workers that work with her daughter. And she made a gift in her honor. So that's the type of person that we're hearing from, and that's the type of gift we're getting to this fund. There's been very, very broad PR associated with this fund because New York Life and Cigna CEOs have been the ones directly involved in doing the asking for building the portfolio of the fund and also talking about it.
Holly, I saw on PBS last night, Judy Woodruff said that 100 nurses nationwide so far have died of the COVID-19.
Truly an astonishing thing to think about and sobering, and so glad that we have a fund that can support those families as they need it during this time. We think this is, you know, the firefighter type response in 9/11. We think this is our frontline first responder in this crisis, and so grateful to be able to work on this. It's been a labor of love for a lot of people at the foundation and at E4E to try to make it come together in 3 weeks. You can imagine how that would go with two very large companies and this type of gift, but it's been incredibly rewarding to provide it, Michael, as we see those stories coming out. I just read another one this morning about a nurse in Charlotte who has passed away. So I think what we're doing is turning our attention now to try to figure out how do we get all the awareness building that we need to get in front of these families to make sure that they know that this is a program that's available to them. There's a major communications and PR campaign underway through Cigna's healthcare networks to let people know, but also we're obviously doing some things ourselves at E4E to try to figure out and work with them to get the information in front of folks. And if there are specific people that we know of, we're also trying to figure out a way to get in front of them directly. So I think that's my report. Passing it back to Michael and going to, I think, Catherine and Whitney.
Thank you, Holly and Brian. I hope those of you that are with us are proud of your community foundation. I hope you're as proud as I am of Brian and Holly and their teams. And it's an honor for us to be doing this kind of work. I just have to say, when Holly said it took 3 weeks to open the Brave of Heart Fund, there was one time when she was on the phone with 22 attorneys at one time. So if that doesn't give you a
productive call, Michael, what are you saying?
That doesn't give you an indication of what it takes to set up something so mammoth and such national scope. That gives you some idea. So finally, with our last agenda item, and I know we're over time, so we're going to go very quickly through these slides. Dana, if you would, we just want to say for your further consideration on a macro level that the nonprofit community you help support so generously plays a critical role in this time. It's sometimes surprising for people to learn that 10% of the American workforce is employed by the nonprofit sector, and we actually do generate 5% of GDP. So there's great value here. And many of those nonprofits have 3 or less months of cash on hand. They're facing this increased demand. Unrestricted funding is critical to them. We are wanting to make sure that that you hear that with your generosity, emergency relief cannot replace the annual giving. Brian mentioned this before. We can't emphasize it enough because if they don't have the core money to sustain themselves, they can't do the efforts for emergency relief. So we're asking you and your generosity through your funds to consider both immediate and long-term sustainable support if possible. And to be ever mindful of the vulnerable communities. We don't want to see all this leading on opportunity economic mobility just be wiped away overnight because the crisis has exacerbated the differences in economic opportunity in our community. Next slide. During the Great Recession, many foundations increased their giving. the stock market will rebound, but without support, organizations may not. And in 2008, many donors exceeded their regular spending from their funds at the foundation. And the donor advised fund provided a mechanism for greater response, and many of you have those funds with us. We are again seeing philanthropy step up in big ways. The regional response funds, corporate and individual philanthropic gifts. There's a push for private foundations to convert previously designated grants that they've done to unrestricted. There's also been incentives in the tax code through the CARES Act, I'm going to talk about very briefly, to encourage charitable giving. And there's a trend toward greater spending from funds and foundations in general. Next slide, please. So we hope you'll continue to support the organizations that you care about. Unrestricted general operating support is what they need most right now. We ask you to consider not just how much you give, but when you give. Some people who give at the end of the year in December have decided to give their grants that they normally do then, today, now, some 8 months earlier. We're trying to leverage networks and combine financial support and time with time contribution of expertise. So we wanted you to know that the framework that you might consider in all of your giving has been so well designed with the strategic giving guidebook that we created. I want you to know that this guidebook has been hailed across the country as the state-of-the-art guidebook to giving generally, and so much so that we had to copyright it because everybody was stealing it. And I think that's the best compliment you can give. And so if you ever want to use this source, it is available to all of you who are fund holders and philanthropic partners. The CARES Act is something to point out to you because it has enabled more giving and a greater tax incentive to do so. So for individuals, it's removed the cap on annual cash contributions. For those who itemize, it's raised it from 60% of adjusted gross income to 100%. Donor advised funds and private foundations were specifically excluded in that, however, unfortunately. For giving to us directly with those. For corporations, the annual AGI limit raised from 10% to 25%. For food donations from corporations at 25% of AGI, up from 15%. So government is trying to give us all incentives to give more. Next slide, please. So now we're over, but if you had any really important questions, we did want to have the opportunity to ask them. As Whitney said in the opening, we certainly can answer your questions over time if we don't get them to today. And finally, before I toss that to questions, I just wanted to say to you that it's a privilege for us to serve you, but we want you to know that the exception of E4E, which is funded by the corporations who set up funds, all of this civic work in our COVID response is not possible if it wasn't for you having funds with us. We know that you see the fees on those funds as service to you, but it is also true that the fees on those funds allow us to do all this civic leadership work. We have no operating endowment, we run no annual campaign. So you can take great pride in the fact that whether you gave to the COVID response fund or not with a specific gift to it, you are supporting it by the infrastructure of the foundation you support through your fees to be able to have us do the work that Brian and his team, for example, so ably do. So we're grateful. With that, I open it up to any questions, and I know we're over time, Whitney.
So far, no questions from our esteemed guests, but please know you can email us if questions come up you think of later. So I think, Dana, if you don't mind going to the next slide, that would be great. I can't thank you all enough for spending time with us today. We know that you all have a lot on your plates, and so thank you for prioritizing this. We are really happy to put this program together based on your feedback, and it's always an honor to serve you. We're going to post the recording on the website, and we'll email you with that information once it's been completed. Please know that if you're interested in the PowerPoint slides, I know there was a question about that. We're happy to send those to you. Before we close out, I wanted to share 2 great resources that are available. As Michael mentioned, our strategic planning guidebook is a great resource, and it's available online through our website. You can see the link there. We're always happy to meet with you, either in person, hopefully sometime in the future, or remotely for now, to work through these exercises. We found that it's been time incredibly well spent. And additionally, the National Center for Family Philanthropy is an incredible trusted partner and resource for philanthropic families. And as a benefit of being a fund holder with us, you have access to their Knowledge Center, which is a virtual library of articles and reports, case studies, and more. It covers a really wide variety of family philanthropy topics. So please use the search tool and find resources that meet your needs. And again, thank you so much for spending time. We really appreciate all that you do in our community. We feel so fortunate to serve you. Please also share your feedback and engage with us on social media. I've included our Instagram handles. We're also on Facebook and LinkedIn. We welcome the opportunity to meet with you remotely. We've been doing a lot of that, and it's been really wonderful to connect and to see your lovely faces online. And we'll continue to work for you in the community. We feel very privileged to be in a position to do so. So thank you again.
Thank you.
Thank you. Thank you.
Thanks, everybody.